Imagine waking up tomorrow morning and discovering that your kidneys may have been sending you quiet warning signs for months without you ever realizing it. The surprising part is that your kidneys can keep working even when their function has already started to change, making the earliest warning signs easy to overlook. Many people believe kidney disease always causes pain, but in reality, some kidney conditions may develop silently, with few or no obvious symptoms during the early stages. That's why the small changes you notice during the first few minutes after waking up may sometimes provide helpful clues that deserve your attention. Morning sign. Number 1. Waking up with noticeably puffy eyes that seem to appear again and again, even after getting a full night's sleep. Occasional puffiness can happen for many harmless reasons, including allergies, a salty meal the night before, poor sleep, or simply getting older. However, if swollen eyes appear almost every morning and are accompanied by other unusual changes, they may be worth discussing with a healthcare professional. Persistent puffiness does not automatically mean you have kidney disease, but it can sometimes be associated with changes in the body's fluid balance or protein levels. Morning sign number 2. Urine that looks unusually foamy every time you use the bathroom after waking up. A few bubbles now and then are usually harmless and can simply happen because urine hits the water with more force or because you're dehydrated. But if the foam appears frequently, lasts for a long time, or keeps returning day after day, it could be worth mentioning to your healthcare provider. In some cases, persistent foamy urine may be related to protein leaking into the urine, although there are several other possible causes as well, which is why proper medical evaluation is important. Morning sign number 3. Waking up with swollen feet or ankles that seem larger than they were the night before. Swollen feet can happen for many different reasons, including standing for long hours, hot weather, certain medications, or circulation problems. However, if swelling becomes frequent, affects both legs, or is accompanied by other symptoms, it deserves medical attention rather than being ignored. When the kidneys are unable to regulate fluid as effectively, swelling may occur in some people, although many other conditions can cause the same symptom. Morning sign number 4. Waking up feeling unusually tired or completely drained, even after what seemed like a full night's sleep. Morning fatigue is common and may result from poor sleep, stress, dehydration, or many other everyday factors that have nothing to do with your kidneys. However, if extreme tiredness becomes persistent and is accompanied by other warning signs, it may be worth discussing with a healthcare professional. In some kidney conditions, fatigue may occur because the kidneys can affect several important processes in the body, but only proper medical testing can determine the actual cause. Morning sign number 5. Waking up with an unusually dry mouth and feeling thirsty almost every single morning, even if you drank water the night before. Dry mouth in the morning is very common and may simply be caused by sleeping with your mouth open, dry indoor air, certain medications, or not drinking enough fluids. However, if excessive thirst continues day after day, especially alongside frequent urination or other unusual symptoms, it deserves proper medical evaluation. Persistent thirst can have many possible explanations, including diabetes, certain medications, dehydration, or in some cases, changes related to kidney function, so only proper medical testing can identify the cause. Morning sign number 6. Waking up with unusually itchy skin that keeps returning even when you haven't changed your soap, lotion, or laundry detergent. Itchy skin is extremely common and is often caused by dry skin, allergies, eczema, weather changes, or many other everyday conditions unrelated to kidney health. However, if persistent itching is severe, keeps returning without a clear reason, or occurs together with other unusual symptoms, it should be discussed with a healthcare professional. In some advanced kidney conditions, waste products may build up in the body and contribute to itching, but many other medical conditions can produce the same symptom, making proper evaluation essential. Morning sign number 7. Waking up with a metallic taste in your mouth or finding that your breakfast suddenly doesn't taste the way it normally does. Changes in taste can happen for many reasons, including certain medications, dental problems, infections, vitamin deficiencies, or simply getting older. If this unusual taste keeps returning, especially together with nausea, fatigue, or other persistent symptoms, it's important to arrange a medical evaluation rather than trying to diagnose the cause yourself. These morning changes do not automatically mean you have kidney disease, but recognizing persistent symptoms early and discussing them with a qualified healthcare professional may help identify the real cause and ensure you receive appropriate care. The good news is that many kidney problems can be managed more effectively when they are recognized early, which is why paying attention to persistent changes in your body is so important. If you've noticed one or more of these symptoms repeatedly, don't panic, but don't ignore them either. A qualified healthcare professional can help determine the underlying cause. Simple medical tests, when recommended by your healthcare provider, may help evaluate how well your kidneys are working and guide the next steps if needed. This video is for educational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. If you have persistent symptoms or concerns about your health, please consult a qualified healthcare professional. If you found this video helpful, subscribe to Silent Signs for more evidence-based health education and share this video with someone who may benefit from recognizing these silent warning signs.